Hello everyone, myself Indrakshi Soikia, a second semester student from Electronics and Telecommunication Department at VBC. Today, me and my friends are going to present a presentation on the idea of diagnostic imaging technology. Firstly, what is diagnostic imaging technology? Diagnostic imaging technology refers to the tools and techniques that is used to create a visual representation of the inside of the body for clinical analysis and diagnosis. It has many importances in today's practical medical field. Some of such importances are like accurate diagnosis, guides treatments, it is non-invasive, it has good monitoring progress, and it reduces the need for exploratory surgery. So, what are the different kinds of imaging modalities used in medical diagnostics? The first one can be X-ray imaging, that is radiography. Second one can be CT scan, that is computed tomography, ultrasound, MRI, that is magnetic resonance imaging, and the last one, positron emission tomography, that is called PET. So these are the different types of imaging modalities used in diagnostic. So firstly, we are going to talk about X-ray imaging, that is radiography. How it works? X-ray imaging uses ionizing radiation to create pictures of the internal structure of the body. The X-ray pass through the body and different tissues absorb them in varying degrees. Dense tissues like bones absorb more radiation, appearing white on the image, while softer tissues, that is for example muscles, absorb less and appear darker. So what are the uses of X-ray imaging? The uses of X-ray imaging are in detecting bone fractures and joint dislocations, diagnosing infections such as pneumonia, monitoring lung conditions. For example, chest X-ray is commonly used to detect lung disease like pneumonia or tuberculosis. So, what are the pros and cons of this X-ray imaging? Now, X-ray imaging is fast and cheap, okay, but it involves radiation, which is not a very useful factor for human body. Secondly, we are going to talk about CT scan. CT scan, that is computed tomography. The CT scan is more advanced form of X-ray imaging. It uses multiple X-ray images taken from different angles, which are computed and processes to create cross-sectional 2D or 3D images of the body. It provides more detailed information than a standard X-ray. What are the uses of CT scan? The uses of CT scans are like detailed imaging of the brain, chest, abdomen and pelvis, detecting cancers, internal bleeding and injuries, identifying heart diseases. Now the example of CT scan are CT scans are most often used in trauma cases like car accidents, which to quickly assess the extent of injuries. So the pros and cons of CT scan are it is cheap and fast, but it has more detailed information than X-ray imaging, and like the X-ray imaging, it has a disadvantage, that is it has radiation. It contains radiation which is not good for human body. Now my friend Sunaina Sarkar will continue the next slide, which is MRI.
Hello everyone, myself Sunaina Sarkar, a second semester student of Electronics and Telecommunication Department at BBSA. So today I am going to discuss about the working principle, uses, benefits and disadvantages of MRI. MRI uses a strong magnetic field to align hydrogen nuclei in your body. Radio waves then briefly knock these nuclei out of alignment. As they return to the aligned state, they emit signals that are detected and used to create detailed images of internal structures. Uses: diagnosing a widening range of conditions affecting the brain, spinal cord, muscles, joint, heart, blood vessels, organs and breasts. Useful for detecting tumors, injuries, infections and other abnormalities. Advantages: no ionization radiations. Excellent detail in soft tissues. Images can be taken in any directions. Disadvantages: expensive, long scan times can cause issues for people with certain metallic implants. Loud, can be claustrophobic. Now I am going to discuss about the uses, working principle, benefits and disadvantages of ultrasound. Ultrasound uses high frequency sound waves that are sent into the body. These waves bounce off internal structures and the echoes are detected and used to create real-time images. Uses: imaging organs like liver, kidneys, gallbladder, uterus, etc. Monitoring fetal development during pregnancy. Guiding biopsies, accessing blood flow, and visualizing superficial structures like muscles and tendons. Advantages included real-time imaging, no ionizing radiation, portable and relatively inexpensive, can access blood flow. Disadvantages like image quality can be affected by air, bone and patient size. Lower resolution compared to MRI or CT scan for some structures. Operator dependent, image quality relies on the skill in the sonography. Now our next topic is positron emission tomography. Positron emission tomography involves injecting a small amount of radioactive tracker into the body. The tracker emits positrons which collides with electrons, producing gamma rays. These gamma rays are detected by the scanner and a computer creates images showing the metabolic activity of tissues and organs based on tracker contraction. Uses: primarily used in oncology, neurology and cardiology. Advantages: provides functional and metabolic information, not just structural. Can detect diseases at an early stage, often before structural changes are visible on other imaging. Useful for difference between active cancer and scar tissues. Disadvantages included involves exposure to a small amount of radiation, relatively inexpensive, limited availability of radio trackers and scanners, lower anatomical detail compared to CT and MRI. Now lastly, I will be discussing about the advantages of diagnostic imaging. So advantages of diagnostic imaging included early detection, enables identification of diseases and conditions in their early stage, accurate diagnosis, provided detailed visual information for precise identification of medical issues, treatment planning, guides healthcare professionals in developing effective treatment strategies. Monitoring treatment allows for assessment of how well treatments are working over time. Improve patient outcomes. Earlier and more accurate diagnosis and effective treatment lead to better health outcomes. So that's all about my slides, and the next slides will be continued by Shatrupa Sutradhar.
Hello everyone, my name is Shatrupa Sutradhar and I am from ET department BBSc. Today I will be discussing about the diagnostic imaging technology. So here I start with the slide 9 of our presentation, which contains challenges and limitations of diagnostic imaging technology. Some key points of diagnostic imaging technology are radiation exposure, limited accessibility, technical expertise required, patient safety and comfort. In AI-assisted diagnosis, it refers to the use of AI technologies in medical professionals and to diagnose diseases and conditions more accurately and efficiently. Then, portable image diagnosis. 3D and 2D imaging. In 3D imaging and 2D imaging, it includes X-rays, ultrasound, 2D CT scan and MRI. 3D MRI, 3D CT scan, 3D ultrasound. PET set. We have our conclusions. Diagnostic imaging technology has revolutionized modern medicine by enabling non-invasive, accurate and early detection of diseases. From traditional X-rays to advanced modalities like MRI, PET and AI-powered tools, imaging plays a crucial role in diagnosis, treatment planning and patient monitoring. While challenges such as cost, radiation exposure and limited accessibility remain, ongoing innovations are making imaging safe, smarter and more widely available. As technology continues to evolve, diagnostic imaging will remain as the heart of patient-centered care, helping healthcare professionals deliver faster and more effective treatment.